Meet the classic in Optimed's lineup, the Sinus XL. The Sinus XL family contains the only bare metal stents indicated for use in both the aorta and the vena cava. The Sinus XL is a self-expanding closed-cell nitinol stent with a high radial force, designed for symptomatic stenotic or occlusive vascular lesions in the central venous and arterial system, specifically in the straight sections. It's indicated for Vena Cava-Syndrome, often tumor-related, stenoses in straight sections of the abdominal aorta or thoracic aorta, as well as dissections, obstructions of the vena cava as well. Why is this stent unique? Because it offers the widest choice of large lumen closed-cell stent diameters and lengths available, from 16mm to 36mm in diameters and 30 to 100mm in length. The Sinus XL is on a 10 French delivery system, 100 length centimeter device, and compatible with a 0.035-inch guide wire. The delivery system features a braided sheath, atraumatic soft tip, and Radiopaque markers. The stent is also securely held in position with our anti-jump technique, which prevents stent misplacement during deployment. That means it can handle even rare or complex vessel sizes with precision. The key features of this stent are the outstanding radial force from its closed cell design to preserve vital vessels, the Tentalum markers for excellent visibility, 4 distal and 4 proximal markers, and the anti-jump technique to prevent stent misplacement during deployment. The Optimed XL stents have Class 3 approval with a large selection of diameters and lengths, and has demonstrated proven clinical performance. The Sinus XL delivers a combination of strength, visibility, and size options unmatched in the market. It's a stent for both typical aortic and complex vascular lesions and anatomies, giving physicians more treatment possibilities and patients better outcomes.